My father, as you know, has been in healthcare his entire professional career. We moved back to Colorado Springs from Wyoming when I was, I want to say 3 or 4 years old, and he has been serving this community as a physician ever since.
I was born in Pueblo, but grew up in Colorado Springs. Colorado Springs was very good to me and my family. I took care of thousands of patients, and I had a great practice.
We all treated the patients as if that's who we worked for. I didn't work for Urological Associates. Every patient who walked in was who I worked for.
Growing up, my brothers and I knew that he gave so generously of his time.
Dr. Faricy's always believed in the power of community health. In fact, he was one of Peak Vista's first volunteer physicians, and he rallied his teammates at Urologic Associates to do the same, improving the lives of the people we serve and giving them access to capability that they otherwise would never have been able to get to.
But that really was special to him and something he did, and he took a lot of time out of his professional life and his family life to do because it matters.
He started over 3 decades ago with convincing others of the importance of community health and participation as a member of the community. And it isn't even that we owe it back to the community, it's a natural response.
Peak Vista gave us the opportunity to serve the underserved. If you can help people that are downtrodden to cope with life a little easier, offer them some type of respite in whatever their concerns or illnesses are, it's special. Peak Vista is the one place where the underserved can get medical care.
When I joined, Patrick said, all of us volunteer at Peak Vista. And at first, my initial reaction was, well, I'd like to build my practice and not take time away from practice. And Patrick sat me down and he said, Jeffrey, and I knew when he was trying to convey something serious, he would call me Jeffrey. He would say, Jeffrey, these are members of our community, and we have a moral and ethical obligation to take care of them, but we also will have to take care of them eventually if they don't get our care, because they'll end up in the emergency room. If patients are utilizing the emergency room for their first line of care, not only is it expensive, but it's not good care, because the emergency room isn't designed for that. And so having a facility like the Community Health Center is extraordinarily important.
Even after stepping away from the active practice of medicine, Dr. Faricy served in leadership roles in the community, including being the chief medical officer at Memorial Hospital.
At a critical time in the community, when Memorial was looking at University of Colorado Health, Patrick did a terrific job of blending the needs of the community and also taking into consideration the employees and the doctors that worked at Memorial.
I think he understood fundamentally that this was an important transition and really something that I think was going to be of value for the community of Colorado Springs, for the physicians, for the nursing staff, for the hospital in general. And I think Dr. Faricy knew how to kind of navigate that with a sort of a steady hand and understand that fundamentally we're still going to be doctors, still taking care of our patients, and that's not going to change. And I think somebody who had a long career such as Pat Faricy understands that the important thing is to keep the patient in the center of everything.
I think you would be wise if you were in my chair to have a long-serving physician, especially one of such great character as Dr. Faricy. He wants to help his community and his hospital be better. So we are very fortunate to have someone like Dr. Faricy on our board.
Dr. Faricy was somebody that you could call 24 hours a day, even after having the worst possible day, and he would do the right thing. That's what you want in your healthcare providers. That's what you want in your colleagues. That's what you want in your community. And that's what we got from Dr. Faricy.
I believe Patrick and his involvement in so many organizations lead him to this award of Champion of Community Health, being the recipient, because Patrick is that guy that has to be giving. That's what makes him who he is, and I'm so proud. I'm so proud to even say I'm a friend to see him receive an award such as this. In my opinion, most deserving.
I can remember vividly walking into a patient's room, and he didn't just stand at the bed. He sat down on the bed with the patient. He held their hand. He looked them in the eye. He made a connection.
I may have changed my ideas of this over time, but I truly believe now that healthcare is a right. As a community, I think it's extremely important to provide healthcare for those that are less fortunate than we are. To paraphrase Desmond Tutu, I don't want to keep pulling people out of the river. I'd like to go upstream and prevent them from falling in. And Peak Vista has that capability to prevent those people from falling in the river.
Patrick Faricy is a true champion of community health, and I will tell you, there's no one, I mean no one, more deserving.
Dr. Faricy is a force for good. He's a healer, and he's made this community much, much healthier place to live.
Patrick, you are receiving a very well-deserved award from Peak Vista, and I congratulate you.
Patrick, congratulations on being a champion of community health. The title you've carried for decades, and now it's official.
Patrick, congratulations on your award. I cannot think of an individual more deserving than you are. Thank you from the bottom of my heart for everything you've done for me and this community.
On behalf of my brothers and me, we do want to extend our heartfelt congratulations to our father. There's no man that I know more deserving.